Okay. Hello, folks. Thanks for joining me. This is just a quick mini lecture just on shade taking in conjunction with the Taha lab. So let's begin. So rule number one: be prepared. Don't just get the patient in and then start getting everything ready because it's waste time. With shade taking and getting this all right, you need to be organized beforehand. You need to have everything ready to go, okay? Because you need your nurse or assistant on board, any consent forms for photography, or if you want to use it for social media, marketing, advertising, whatever, you need to have that all ready. You need to take the shade at the beginning of the appointment. Don't start doing it mid treatment or in the end of treatment. You need to do it before tooth dehydration starts. You have between about 60 seconds and maximum 5 minutes from retraction before teeth start dehydrating. Scan the QR code if you need to, and that will give you a bit of science behind it all. So, what do you need? You need a camera. Ring or twin flash is okay, but I don't want to see giant soft boxes. I don't want to see giant softened images. It's not helpful to the lab, okay? Only soften it if it's for texture or promotional photography, okay? So if you want to get an angled shot, oblique, to show a bit of texture, low light to see some translucency, that's okay. Or promotional before and after photograph for your social media or your advertising, that's okay. But do not soften pictures dramatically for the lab. It just basically ruins our assessment of the tooth, and it just reduces a lot of information that we find critical. Okay, cameras, anything mirrorless at the minute you can get for a good price. The Canon at this stage, at this moment in time, Canon EOS R5 II, Nikon Z9, all relatively quite reasonably priced. You need a 105 macro lens, 1:1 ratio. You need 85mm for portraits. So I would say if you can only pick one, get the 105. But 85mm slightly better for portraits. If you want to get the face in. I prefer manual mode. I don't like autofocus, but some people swear by it. So, autofocus is improving greatly these days. But for me, manual focus. I want f-stop, f22, and f32 if I want more depth of field. But shutter speed, 1 to 200, ISO 1 to 200. I don't see a dramatic difference between them really. White balance, you can go neutral or compensate for your flash or daylight. My honest advice to you is that how I learned was just playing around with settings, taking the same photo, just obviously start with nature or start on your assistant, just practice. And because you don't really need to go on a photography course, once you've got the equipment, just play around, learn. That's how we all learn. So make mistakes, that's fine. But eventually, once you figure it all out, it becomes pretty much second nature. Shade guides, get all your shade guides ready. Yes, we have the standard Vita. Is it the perfect shade guide? No, it is not the perfect shade guide. You can organize it into order of value and all sorts of things. But why do we still use it? Because it's like a baseline understanding that pretty much every tech in the world understands. Every system of color and dentistry, or most systems, are based on the Vita shade guide. So fair play to them. They've nailed the market in terms of shade guides. That's fine. But they've got the VT 3D Master, which is just elevating it up to a little bit more detail, a little bit more natural transition of the color. And then you've got the bleach Vita shades as well. Ivoclar dye stumps like the ND2, ND3, ND4, they're helpful to have if you want to take a stump shade. Ivoclar also have like their shade guides for high translucency, low translucency, if you want to check the ingots. Sometimes it's helpful depending on whatever ceramic system your technician's using, whether it's Creation or GC's, Lissy, or Ivoclar, it doesn't matter. Sometimes getting a customized shade guide of that system is very, very helpful. And you can get a copy of that, get your technician to send you a copy of that ceramic so that they can take a photo against it. Especially the dentine version, it's very, very helpful. If you need pink porcelain for if you're doing implant work, or soft, if you need to do, if it's a case where you're going to do pink porcelain, it's worth having a pink porcelain shade guide. If you're doing denture pontics, like, you can get these Ivoclar and Neres ones or Shotlander ones. So, good to have a shade guide for them. And then if you have your own custom shade guide that you've made for even composites or something like that. So, there's loads of shade guides, and you need to pick the right one for the case that you are doing. Polarizer. I think this is essential if you're sending anything to a lab, our lab especially, that is single central based. We really need this polarized photo. It removes reflections, takes the glare out of the picture. It just shows us the true nature of the tooth, okay? And it doesn't matter whether you do it with a ring or a twin flash, but for every normal shade photo, we need the exact same photo with a polarized filter. So if you take a photo with a A3 shade tab, I want the exact same photo polarized, okay? So I can compare and contrast, okay? The more information you give us at the lab, the more we can help you and the better the result. The less information you give us, the more we're guessing and the more inconsistent you're going to get a result, okay? Loads of forms out: polarize, SmileLine, MDP2, dentalize, hero photography. You just literally go on Google, search for dental polarizer. So many options that will find and fit your camera, okay? So don't worry about that, but you must have this. Flexible matte black silicone contrasters, not the hard metal ones that don't bend. We must have the flexible matte ones. SmileLine do the Flexi palette. You can get the A, B, and C. Photodent, you can even get them from AliExpress. I understand that, some of these are expensive, so, obviously sometimes the quality, if you get a little bit cheaper, is not as good. But in certain scenarios, it can save a lot of money and do just as good a job. So just there's no harm in trying out a few things if you're willing to experiment. Retractors, you can get plastic or metal. Ideally, try and get matte black ones so they don't cause a flash or a bright alter the image that you're getting. And you can even use an Optrogate too. I don't have an issue of it. Sometimes if you have difficulty retraction, you can cut a retractor in half, especially if it's a large plastic one, and then you can get the patient to retract up a little bit more if you need to get a bit more of the soft tissue, okay? Mirrors, heated or defogging Ultra HD mirrors, always helpful. The Action, not Action, Pure Reflect, large occlusal, large lingual, vestibular lateral. They're really good. But you can buy a cassette to put the mirrors in, really cheap. You can buy one from UK Dentistry, 60-70 quid, even less. But I find that mirrors get scratched very easily if they're not there in their own purpose cassette. So the cassette will save you a lot of money in the long run and stop your mirrors from getting scratched, okay? Look at AliExpress, look at Amazon. You can get these ones that have a fan in them and a light, so they're really helpful and you can get different ones that connect into it. So, where there's a will, there's a way, and just try and look at different alternatives, okay? Because mirrors can be very expensive if they keep getting scratched. One of the things that we would recommend if you're going to send us complex single central cases is something called a SmileLine OptiShade, okay? It's basically a it allows us to do spectrophotometric analysis, okay? So it's like digital analysis of the luminosity and the red, yellow colors that are in a tooth, and it makes it, what it does is it's very clever. The AI system, once we take a photo of a tooth with the colorimeter or the spectro with the analysis, is that we get a recipe, and this recipe gives us an AI generated recipe, gives us the color map of how to layer a tooth. So we're going to be far closer. Now, this is expensive, but if you do a lot of anterior cosmetic cases, you're looking around about 1,500 to 2,000 for the system, but it is worth its weight in gold if you're doing a lot of anterior cases, okay? And if you're doing like a couple of single central unit cases, it's going to get you out of jail. It's going to stop you from having to do a lot of repeats, a lot of back and forth. It's going to save you and the patient a lot of time. So I would 100% recommend getting this, especially if you're doing single central cases or complex anterior work, okay? It is essential. Um, if you're going to use your intraoral scanner, some people use the Trios, or they've got different scanners that can take HD photos. That's fine. Don't have an issue with it. Can be quite helpful, and I do encourage it. But still, to this day, we haven't found anything better than a high res digital camera photo, and combined with like the colorimeter or a spectro with the spectro photometric analysis. Nothing's better than when we combine the OptiShade with a high res digital image, okay? It sounds stupid, but make sure all your batteries are charged, you've got spare batteries, your memory cards aren't full. You know, just a little bit of organization and logic makes your life go a lot easier. Clean the tooth first. Don't dehydrate. Remove anything that affects color. Plaques, stains, lipstick, bright colored clothing or jewelry. Neutral bib or drape is preferred. I don't even I try and take photos without anything on, like just keep if the patient's got like a black top on, that's perfect. And the patient should be seated upright at eye level, sometimes against a white wall with a glove box behind the head. So this is just something I do. I get them to sit on a stool. I've got a white wall, and I get a box just behind the back of their head, and that keeps their head upright. And then when I do their after photos, it's the same thing. So it's really, really helpful. Use neutral, consistent lighting. Obviously, natural daylight is the best. Avoid strongly colored reflections or glare. You don't want to have like the sun beating in on one side of their face, or use your surgery light that's a bit too yellow, okay? Keep each visual comparisons brief, about 5 to 7 seconds. Then look away to a neutral grey or a blue surface to reset the eyes, okay? If you stare too long on a shade tab and looking at a colour, you'll find that your eyes just can't relax enough to get into good shot. So just don't do more than 5 to 7 seconds if you're analysing. It reduces the fatigue, improves the accuracy. Get a second opinion from your assistant. I always do. I always put a few shades on. I walk out of the room. I go, can you have a look and see what you think, which one you think it is? And invariably, 9 times out of 10, they agree with what my assessment is. I don't tell them what I've picked. I go down to 2, and then in my mind, I think I know which one it is, but I don't tell anyone. I then leave the room, let the patient close a little bit, rehydrate, have a chat to assistant, and then I get my assistant just to go do it. And then I come back into the room like a minute or two later, then they're all chatting away, and I go to my assistant, what color did you get? Okay? And quite often they get the same one as you. Compare the tooth and the shade tab side by side at the same angle. How many times have I seen people do it at 90 degrees or something crazy, okay? With the long axis of the tooth, please, okay? Distance roughly 61 to 183 from the mouth is considered suitable, and the operator should stand directly in front of the patient. Now, I would get your assistant to hold the tab while you take the photo, okay? But sometimes it's very difficult to do. I know that some guys are, well, but try and train your assistants to get it in this position. Tell them where you want it and how you want it, okay? It's going to be much easier than you trying to hold the camera and hold the tab and get the focus. It's impossible to get it all perfect. It's hard work. It's not impossible, but it's hard work, okay? So make your life easier and make it logical. I don't want the shade tab to be 5 centimeters behind. I don't want it to be right towards the lens. I want it to be in line, above, and in the same orientation. Remember that where we're analyzing shades, we need to know that the cervical has higher chroma. We got more dentine, less enamel. We've got the influence of the pink from the gum. Okay, we normally use the middle section of the tooth, the mid body, for the main body of the color selection of a tooth. And in incisal we've got lower value, highest translucency. We've got mamelons that have high opacity, low chroma. We need to be considerate of how we're putting things and how we're analyzing the cases. Now, confirm the choice with a second shade comparison, one slightly lighter and one slightly darker. Now, I just break it down into 2 shades, but if you want to do one slightly lighter, one slightly darker, one for the dentine, one for the enamel, that's okay, but I try and keep it as simple as humanly possible. This is useful when the adjacent teeth are asymmetric or have got weird characterizations and, as we call them, intensives. A black and white photo for us for value is also very helpful, and with each of the shade tabs. Remember, a polarized photo for every single normal shade photo. So if you're taking a shade tab to the tooth, take that photo, and then I want a polarized photo exactly the same. Okay, if you can do that, it makes our life immeasurably helpful. Okay, so thank you for listening to this short, sweet lecture. Part 1 over and done with. Part 2 is available for all the anterior indirect course attendees. Visit tahadental.co.uk courses if you want to attend one of our live patient anterior courses, veneer courses. And then also for lab customers, we'll also be making the part 2 available to you. Okay, so thank you so much for listening. I hope you enjoyed this complimentary lecture and have a great day.